that we could all advocate for, but obviously we can't do everything all the time. We don't have the resources to do that. And we wanted to get a sense of what STD and HIV directors wanted to do both separately and together, and what made sense for us to prioritize within our fields as well as a group. And we also wanted to get a sense of the various policy options that we could take on, what also made sense from a researcher's point of view, because some of us have more experience than others in actually figuring out how the data matches our different policy agendas. And we wanted to hear from researchers directly of all the different policy options we could advocate for, what made sense to them as to what would have the biggest impact. And the third group we wanted to involve are advocates, because again, while some of us have experience in designing programs, not all of us understand what's the most likely to be either funded or enacted and to be feasible politically in Washington. So that's the genesis of this. We're going to go through the preliminary results today and give you a sense of what we found and review the process with you. And then we're going to have time at the end to get your reactions to this, as well as get some discussion going of what could be the next steps based on all this. Just a couple of technical things. I'm going to introduce some other folks on the call. One, hopefully you're all muted, and if you're not muted, please do mute yourselves, and then we'll unleash all of your voices at about half an hour or 40 minutes from now. Also, this call is being recorded. If you need to communicate with one of us, the best thing is hopefully you can see the chat panel at the bottom left of your screen. We'll be monitoring that, and you can communicate through there. So with that said, what I want to do is introduce some other folks on the phone. We have Suzanne Miller from the National Coalition of STD Directors, their policy director, and we also have Bill Smith from NCSD. Also, we have Lynn Barclay from the American Social Health Association, and we have Mary Kane and Brenda from Concept Systems, which has been leading this process. Before I go any further, I want to give a big shout out to several organizations and key people. One is Jeannie Marazzo, who couldn't be with us today, from the American STD Association, as well as ASHA and Lynn Barclay, the American Social Health Association, which really helped support this, as well as our colleagues at NASTAD, who helped coordinate this project. So with that, what I want to do is turn it over to Mary Kane, who will be leading us through the results.
Thank you very much, Dan, and thanks everyone for attending. I am aware that a chunk of time like this on a day that everybody is so busy is a real commitment, so it's much, much appreciated. I would just like to...
This is Hunter, and I will put it back on mute, but I wonder if it would be possible without just so... to just list the names, don't affiliations, just tell us the names of everybody who's on this call. Is that feasible? Or
yeah, I can do that as long as everybody wrote their names, and not everybody did. So I could read you all of your phone numbers, but that's not going to be very productive. Let me tell you who's currently in. Alana Ward, Barbara Conrad, Bridget Verrett, Heidi Bauer, Hugh Hunter, Kyle, Lynn Barclay, Matthew Hogben, Ralph Wilmuth, Roxanne Arith, and Bill Smith, as well as Brenda, Suzanne, and I, and Mary. And I want to thank all of you for participating, as well as the several hundred other people that did. Can you not see the list of participants on the left?
No, Dan.
No, okay. All right, back to you, Mary.
Great. Yes, so thank you for that. If there is anyone else, just note your name in the chat, and we'll make sure that everybody gets acknowledged. We just want to, Concept Systems, Brenda Pape has been the project manager on this project, and Jesse Hilliker has been project support, and they've just done a wonderful job. And Dan is, of course, one of our favorite concept mappers. So it's nice to be able to work with him as well. And I do want to thank Suzanne, Lynn, and Bill particularly as well, because they've done a lot of work throughout the process in conjunction with Dan and CSI. So looking then at where we've been, I'm going to go back one. I'm sorry. This is a little... What I'd like to share with you for a moment is just to refresh your memory. Almost a year ago, we asked a question of the field, and we'll tell you who those folks were in just a minute. But the purpose of the question was really to get at exactly what Dan was just describing, and that is to identify what makes sense from the point of view of program folks, program directors, from the point of view of researchers, and the point of view of advocacy people around what might change, what might make change at the policy level in order to reduce HIV or STD transmission in the next 2 to 5 years. So the question, in concept mapping, we ask one question, and then we welcome all comers when it comes to answers. And so the question was a policy at the national level, that is legislation or an initiative that would have an impact on reducing HIV or STD transmission in the next 2 to 5 years is. And I'm hopeful that this rings some bells with you folks, that because we are assuming that you were among the many folks who actually took part in the process itself. The two important things about concept mapping are the focus that I just described in this case, and who answers it. And these two questions are really critically important and related to each other. So this project was quite involving in a very interesting kind of way. The design was very deliberate, and Dan worked extremely hard with the planning group to make sure that representation was appropriate and that we could count on hearing these voices. So 332 people were invited to answer this question via the web, and about 114 people, or 114 people or so, actually did the brainstorming. We invited 332 people to sort, and 10%, a little over 10% of those folks actually did the sorting, and that's not unusual, and we can talk about that as you'd be interested. A total of 332, again, the same folks were invited to rate, but they were invited to rate on different things. So 82 people rated on HIV impact, 75 people rated on STD impact, and 32 people rated on funding and enacted for analysis. And I'll tell you about those ratings in just a moment. Once we were able to get the information from the people, these ratings were, I'm sorry, I'm skipping ahead. I have to learn how to do this.
If you hit the previous and the next, you'll, instead of hitting on the slides, it should work better.
No, I seem to be doing both. I apologize. So in the brainstorming step, we were actually able to surface 232 specific ideas. And some of those are listed on slide 5, as you see. And these are just a few extracted examples of statements, and they have to do with things like integrating STD, viral hepatitis, and HIV programs at the federal, state, and local level, expanding training about HIV and STD in medical and nursing schools, completely repeal abstinence-only legislation. So there was, as you can see, a mixture of focus on a specific focus that someone answered the question with. The next slide shows what we talked about in terms of the ratings that I just referenced. And in this project, we actually asked 3 different ratings questions of different audiences. So the first question we asked was, please rate each of the following items according to how much impact you think it would have if carried out on increasing or decreasing HIV transmission rates. The second question was with an STD focus. The same question, there's an error here. This is supposed to say STD. Which is intended to say increasing or decreasing STD transmission rates. And then the funding and enacted question was, please rate each of the following items according to how likely you think each item is to receive funding or to be enacted. And that is, in a way, a feasibility question, a support question for the things that we wanted to know more about. In building the conceptual framework then, the steps that we have taken so far were to develop the focus, to identify all of the participants who should be included, and that was a very intensely involving process that worked really great. We generated the ideas from those folks. Then we invited people to structure those ideas, and those are the individuals who sorted the ideas. Then we computed the maps. The next slide just indicates that the step in the process around turning data into meaning is exactly where we are today. And today we're talking about looking at the maps that have resulted from the asking of that question and the mining of the specific feedback that individuals gave us, and overlaying then the ratings of the answers to those 3 ratings questions over the map to see the relationship between potential impact and potential fundability or enactment. The next thing that will be done, and we'll be having some questions about this toward the end, and that is how we then use these maps and use the information that's provided in them in order to advance the questions and in order actually to create something that can be used by each of the audience groups, as it were, as well as the field more broadly described. And that, I believe, is really the intention of the project itself. I want to back up for a moment and give you just, again, some brief guidance about when this stuff took place, just to trigger your memory. From last May, we actually did the brainstorming, and we had 114 anonymous visits to the site, to the website that we hosted, and then we edited that statement set down to 102 in order to encourage the sorting and rating that needed to take place next. Then we organized those things, or asked you to organize them, I should say, between August and October. And that was conducted in a couple of different steps. The key component there was to ensure that we were inviting individuals to sort, and that those who were going to be asked to rate certain items were getting the right information to rate from. So at this point in the process, we have 102 specific, very targeted ideas based upon your responses to the focus prompt. We have a sorting construct that has allowed us now to build a map that is actually authored by those who took part in the sorting. We then have the overlay maps of each of the ratings and our ability to compare those to each other. And then the steps that I'm going to show you next are what the results look like. How these things came together are a really interesting combination of both qualitative and quantitative social research approaches. And the first step is just collecting the raw materials, asking you what you thought in response to the question, asking people to provide feedback as to how these ideas are organized in your mind, in the way your taxonomy of these issues would show. And then how these the rating scales were going to provide us with some priority or comparative relevance. And then the quantitative aspects or the statistical analyses that are run on those things include these things that you see here. Multidimensional scaling and cluster analysis as the primary ones. The concept mapping tools that we use allow many, many other analyses as well, but these are the fundamental ones that build the map. And speaking of the map, the next 4 slides are pictures of what is called a point map for obvious reasons. And this map, if I can just orient you for a moment, is a 2-dimensional array of the relationship of the ideas, of one idea to every single other idea in that array of 102 specific ideas. And the focus here is that the closer 2 ideas are on this 2-dimensional representation of the multidimensional analysis, the more similar in meaning those 2 ideas were thought to be by the people who sorted the ideas. And recall that the individuals sorted them, so the aggregation of that data is the link between the individual's perception of relationship of these ideas and the summing up of how these ideas are related to each other from the point of view now of a group. So we have sort of formed a thinking group around this process. On this map, The numbers themselves are relevant only as identification numbers. They are not arrayed in any sense of importance or anything. You'll see on the map that there are 102 of these numbers, ranging from 1 up in the northwest corner to 102 very close to the center of the map. Location matters here only as relationship to other points. The map itself is based upon the analysis that is relational rather than positional. This is an important distinction because I will be showing you some pictures later whereby it does matter positionally where items are arrayed in another picture about values. But in this case, this map basically describes the universe of ideas, of those 102 ideas, and their relationship to each other. And when we look at slide number 14, you're seeing that if we look first at slide number 13, you're seeing in the East Coast we have an idea that is described as to require all alcohol and tobacco taxes, etc., be focused on public health efforts. And then in the following slide, we explore that a little bit further to say that the things around that were thought to be similar in nature or in meaning compared to the other things on the map. And when we look at the slide that follows, which is again another point map, you'll see that the East Coast area has that anchoring idea, number 17. The Northwest area has something, number 57, which says to conduct research that ascertains if comprehensive sex education reduces incidence of HIV and STDs. And on the bottom, on the south, it's a statement that we are using for illustration is to promote screening for HIV and STDs in substance abuse treatment settings. According to those who participated in the sorting, these three ideas were much, much less similar to each other than each of them was to a lot of other content. And so when we are able then to look at things from that point of view, we're able to create an array of relationship of the ideas across the map, which then allows us to conduct some analyses using some tools that are available to us, plus some qualitative review as well, to organize these ideas into groupings. This is something that emerges out of the analysis rather than from our sort of looking at the data and parsing the space. So again, I mentioned the tools that we used before. And this is one of the products of our being able to array the ideas in ways that make sense to the individuals who contributed the sorting, and that then display a commonly authored conceptual framework without losing the detail of the 102 specific statements that are embedded within that conceptual array. Over the course of the next couple of minutes, I'm going to be showing you the content of at least two of the areas, and then we're going to be talking about what the emerging structure looks like as we look at from the ground up, what are the details in these things. And then I'd like to talk with you a little bit about how the ratings get overlaid to the map itself to help us make some determinations as to what might be more viable, what might have greater impact, and from different points of view, what those things might look like. So the next two slides are just pictures of the insides of two of these clusters. And up on the top, on slide 17, you see in the corner a legend of the entire map itself, and the red highlighted cluster is the one which has this set of content in it. The working group went through these in great detail and helped to provide some guidance as to the names of these groupings or clusters. And so these names are really right now the headers for what's inside each of these groups. So we have the ability to organize from the detail, but provide like a chapter heading of this detail so that it accurately describes what's in it. And in this case, the things in this grouping had to do with including health education, including sexual health as a requirement in the educational system from K through college, conducting public education campaigns about how arresting illegal aliens and depriving them of access can spread disease, evaluate programs designed to help African American children and youth to succeed in school, to improve community supports for young gay and bisexual men and transgendered youth so they can build self-esteem, etc., to provide comprehensive sexual education in all schools that include positive images of homosexuality, to implement comprehensive health education policies, develop national campaigns around sexual health, and align national federal comprehensive sexual health education strategy with other federal efforts. So when people conducted the sorting, individuals more often than not thought that these ideas were more logically aligned with each other than they were with the other 95 or so specific ideas on the map. So they emerged then as a grouping or a cluster of ideas. When you see the emerging framework, you'll see that these things are related more or less on the map, but this is really a fundamental grouping that we thought would be of interest to you for a variety of reasons, specifically because of the policy question at hand. The next grouping of ideas is in the south-southwest area, and this is an area that the group labeled screening and prevention. And you'll see that this is just a flavor of some of the things that are in that grouping. If you look back at, I'm going to just look back very quickly to slide 16, you'll see that this grouping has many, many ideas in it. And when we move forward, we're just showing you a snapshot of that idea so that you have a flavor of what's included. So here are some of the things that are included in screening and prevention. To immunize everyone, to increase case detection, and to prioritize partner services for chlamydia, to develop parallel congruent systems at the national level for surveillance, to integrate STD, viral hepatitis, and HIV programs, working with provider organizations to incorporate sexual history, sexual health assessments into clinical care, STD clinics, incentivize industry to provide new drugs for gonorrhea, free access to birth control, funding and promoting screening as part of routine care. So these are things that are some of the things that are captured in the screening and prevention grouping. You can see that it's a very well-informed grouping of ideas. When we look at the next slide then, this is the emerging structure that I was referencing. In this case, you'll see the ones that we have looked at. Federal education legislation is the top left-hand kind of grouping. And then if you want to look at this as a pattern of regions or a pattern of progress through topics, there are multiple ways that you can look at this. If you begin, for example, with federal education legislation and then move to education, we can then look at innovation as bridging the education territory on the map, and then the nuts and bolts, really, of screening and prevention, which leads then to thinking about interventions from a health systems perspective, which is related but not the same. Then there is government involvement related both to health systems interventions and legislations and rights for vulnerable populations, which then, of course, comes around to the concept of legislation that is related to education at the federal level. And there are many ways to talk about this, and I'm very hopeful that you will have those rich conversations about what regions are emerging on the map, or what might be a logical progression through these conceptual constructs that are related to each other on this map, and how well they are defined. So that's the picture that we're working with. This is now essentially kind of a taxonomy of these issues from the point of view of those who authored it. And those who authored it are those who contributed ideas and who then also supported the project by taking part in the sorting aspect as well. I'd like to now turn our attention to what we do with the ratings. And what we do with the ratings is to overlay this conceptual framework that you have seen, so that when we look at this map, this is a two-dimensional array of the relationship of the ideas to each other and of then the groupings of those ideas so that we can make sense of them in clumps or clusters that are 7 rather than 102. We don't lose any of the detail, and you may remember that the ratings are on the 102 specific items, not on the 7 ideas. That's the 7 big ideas. So with that in mind, I thought I would review with you the ratings that we asked people to complete. The HIV impact rating was stated as it's described here. Please rate each of the following items according to how much impact you think it would have if it were carried out on increasing or decreasing HIV transmission rates. And we set a specific scale so that people can quantify what is obviously an observational experience, but qualitative in many aspects judgment that we're asking the experts to make. Similarly, when we look at the question about STD impact, it's essentially the same question, but with the emphasis instead on increasing or decreasing STD transmission rates. So we're looking at impact on this. Then the third one was different from that, and this was a question that we asked about rating each of the following items according to how likely each item is to receive funding or to be enacted, whichever is appropriate, within the next 5 years. And again, we asked a scale on a 1 to 5 like scale that provides the range from which people can operate. I thought I would share with you for a moment who contributed the ideas to the project and in terms of the ratings. At the rating stage, we asked a few questions, and one of the questions was essentially, who are you in your professional role in relation to this question? And so we have a range of advocates, both HIV and STD director, HIV/AIDS director only, researchers, and STD director only. And so the range was, as you can see here, 117 individuals, and the preponderance, well, not the preponderance, but the large minority of folks identified themselves primarily as researchers. Advocates comprised about 24%, and then directors of all kinds were about 34%. And so STD directors 20%, HIV, STD both were 9%, and HIV directors were 5% of the group that contributed ratings. We also asked the question, in which topic area do you believe you have the greatest level of expertise? And people provided feedback on that, indicating that they felt that their highest level of expertise was in HIV/AIDS, broadly described, then HIV and STDs, then STDs, and then family planning and reproductive health, in that order. So this is a little snapshot of the folks who responded with ratings. So these are the respondent questions that we asked when we asked the ratings questions. I'd like now to share with you a few pictures of what people said in terms of the ratings on the content of the map. And what I'd like to do is show you first the high-level picture. If you recall the slide that showed you the emerging structure, what I'd like to do is to share with you some pictures about what that looks like when we align the ratings to make some comparisons. So just to refresh your memory, I'm going to slide back. Avert your eyes if you get dizzy. This slide shows you, again, just to refresh your memory, the elements that are now described at the higher cluster level that still contain all of the details, just to orient your thinking and a recollection as we go into a picture I want to show you that has to do with the ratings and who answered them and their comparisons to each other. What you're seeing here is what we call a pattern match. It's a simple ladder graph that shows the comparison of one rating to another when everyone who has rated is in the picture. So what you're seeing here are two vertical number lines. The number line on the left describes those who rated on HIV impact, which was 82 people. And what you're seeing here is a numerical, essentially a default rank ordering of the potential impact on HIV by the cluster. So in order to produce this picture, what we do is average the content of each cluster and compare it to every other cluster, and then array it on this vertical number line to associate it with where it would fall in some priority setting or some priority describing, as it were, around, in this case, HIV impact from those who provided that rating. Similarly, on the right-hand side, we have the STD, folks who rated on STD impact, and that was an N of 75. You'll see, again, the same cluster names that you may recall from the emerging concept map, and then we see a different array of these on this vertical number line, this default rank ordering by the STD impact contributors. So in this case then, we have some commonalities and we have some differences. And the R in this case is 0.72, which indicates as a correlation, a fairly strong correlation between those on the left side, the HIV impact observation, and the STD impact observation. We do have some distinctions, though, that might be worth looking at. One would be that between HIV and STD, there's a difference of opinion as to the stuff inside the cluster innovation, and we're going to be talking a little bit more detail about that as we go forward. You'll see that the health systems interventions, screening and prevention, federal education legislation, and education are all among the top 5 for everybody. The only real difference is where the innovation line finds itself. And even that, by virtue of the correlation, we can say that that is not a gigantic disconnect between the two groups. So there seems to be quite a bit of commonality between what people said as regards potential for HIV impact and potential for STD impact. Just want to mention that the numbers that you see here are the actual anchors of the ratings. You'll note that the scales are quite small, but this still provides us with the capacity to do some observation about the relationship of the content of these ideas to each other. Similarly then, when we look at the next slide, we're looking at HIV impact. So this is the identical set of placements on the vertical number line as the other left-hand column was on the one we just left. But the right-hand column is different, and now we're comparing the elements that people described as potential HIV impact to those things that people said may be funded, could be funded, or enacted over the next 5 years. So in this case then, we're looking at the elements that are in the innovation cluster as receiving highest impact and highest potential fundability or enactability, if you want to look at it that way, as the others. Similarly, although there is a slight visual gap here, health systems intervention, screening, and prevention are second and third for both of these territories of interest and conversation. A difference here is between what HIV impact folks rated as federal education legislation and what those who rated potential for funding or enacting as possible, or likely, I should say, on the scale. Aside from that federal education legislation slope, there's a great deal of concordance between these two ratings, and that is also indicated by the correlation of 0.84. The next one shows, logically then, STD impact on the left. And remember, that was the one that was on the right in the first pattern match, and funding and enacted on the right now. And we're again seeing a comparison between the elements that were described by the folks who rated STD impact as relatively high compared to relatively low. And again, in this case, the really only meaningful disconnect, again, is federal education legislation, where STD impact had some hopes that it would be of some value if it were addressed, and then the possibility of enacting the elements in that grouping were considered somewhat lower than before. And again, that's reflected, the strength of that slope is reflected in the correlation, which is lower than the others, but still a very strong correlation between the two. So these are the pictures at the conceptual level, at the high level related to the map. Now what I'd like to share with you is a way that we can now dive into each of the groupings on the map and look at what folks said when they contributed ratings on the detail by detail ratings that are embedded in the concept map and in the analysis. And these slides are meant to share with you some pictures around how these things are related to each other in terms of potential impact and potential for funding or enactment. When we do this using a picture that I'm giving you an example of on this slide, number 28, we're actually looking at a simple bivariate plot that describes low and high on one scale and low and high on another scale. So the x-axis may describe what potential for funding and enactment, and the y-axis may describe, in this case, in this example, HIV impact. Where the elements fall on on the sides of the crosshairs describes for us then, for our interpretation and decision making, areas where, or items upon which action might be taken that would have a high yield. If we're looking at things that are both potentially impactful and potentially fundable or enactable, might that be a great place for us to concentrate? So this is the purpose of what we call go zones. This is a go zone. And the areas are the green zone or the go zone, the gap zones. The yellow is, in this case, high X, low Y, and the orange is high Y, low X. And then what we call the O zone or the gray zone, where both are low on the scales that were provided by the people who contributed the ideas. So in this case, this orients you a bit as to what we call a go zone and how we might use it. So I want to show you some actual information. This is a picture of a grouping that we looked at already in some detail. And I want to draw your attention to the fact that here we're talking about HIV impact on the left, on the vertical, and its comparison to, on a point-to-point basis, to what people said as regards their impression of the possibility of this element being funded or enacted within the next 5 years. So in that regard then, as I mentioned before, we have the green zone, which is the area in which you will find things that were identified as both potentially high impact comparatively, again, compared to everything else, and those things that may also have the possibility to be enacted. And in this example, they consist of 3 specific things: to evaluate programs designed to help African American children and youth, especially males, succeed in school; to improve community supports for young, gay, and bisexual men and transgendered youth so they can build health identities and self-esteem; and 69, to implement a comprehensive health education policy in each state that would include alcohol, tobacco, drug use, etc., and HIV, STI education. So these are the 3 things of the things in this grouping. Now we're only talking, we're sort of using the microscope here and going back into the character federal education legislation and just talking about what's in that. And what is in that are those things. Then in the yellow zone, the gap zone that has higher potential to be funded or enacted than it has HIV impact, there are 3 things. And this is interesting to think about how you would take advantage of those things, even though they're thought of as slightly less potential impact. So in this case, we have to develop a national campaign involving many partners and to align national, federal, comprehensive health education strategies with other standard education approaches. So these are things that were thought to be less potential, again, slightly less impactful on HIV, but again, similar to those above it in the potential to get them enacted. Different, though, is the things that are in the orange zone. Again, they still hover around the crosshairs, so nothing is terribly out of line here except one. And in this case, these two are to include health education, including sexual education requirement as a requirement from K to college, and to provide comprehensive sex education in schools that includes positive images of homosexuality. Again, these would have slightly higher impact, but seemingly less potential for being funded. And then there is number 5, which is to conduct public education campaigns about how arresting illegal aliens helps spread disease. This tells us essentially that the folks who rated these things on HIV impact potential and potential to be funded thought that in both cases this was an element that would not garner support, nor would it have impact the way others might. So another snapshot for you would be the next grouping that shows, and this is a 2-slider, this is concentrating on the area legislation and rights for vulnerable populations. And we thought we would share with you the whole set. And you'll see, again, similar to the one above it, there are things in the green zone, particularly 81, which is very high in potential HIV impact and quite high in potential to be enacted. And that is to fund syringe access and harm reduction programming to end IDU-related HIV transmission. And then we have other things that are closer into the means of the averages to the means of the ratings for this cluster, and they are 55 and 96, and they are repeal Section 2500 of the Public Service Health Act, and to completely repeal all abstinence-only legislation. And then I'm just going to go to the gray zone or the O zone now. Number 25, which is on the next slide, is to conduct research and implement best practices to reduce racial segregation in housing. And 54, which was much closer to the center, is to develop national support for gay marriage and parenting adoption rights. And when we see statements like this, we realize that people are voting, as it were, with their ratings as to what they believe the field might best concentrate on. Not that these things are not critical in a systemic way, or not that they should not be addressed in some way by someone. It's just a matter of in some cases perhaps, the match of the focus of that question to the mission of the entity responsible at the moment. I want to show you a picture of the education cluster, which, as you recall from the map, was the one right below the National Education Policy cluster, Federal Education Policy cluster. So in this case, in the area of education, we have 5 things in the go zone that describe an agenda, perhaps, that is both potentially impactful and potentially fundable or enactable. And these are things that include focusing on educating people about actively avoiding transmitting the virus, fund research on structural interventions, expand school-based health centers, expand training about HIV and STD in medical and nursing schools, and distributing condoms in correctional facilities. And then the others are scattered, as you can see. Again, in the O zone, we have number 40, which is to fund community education programs on women drug users who have sex with women and have enhanced risks for STIs and HIV. So that would be an interesting conversation to have as regards why some of these elements emerged in those places based upon the ratings that people provided. I'm going to shift emphasis here for a moment to show you similar pictures, but now we're looking at those who rated according to potential impact on STD now rather than HIV. So what I've shown you is just some examples of how you can look at the contents of each of the clusters to ascertain those things that seem to emerge as appropriate agenda starters or agenda confirmation elements, those things that are both high, in their crosstalk as to the ratings, and those which require some conversation around how you as a field might proceed. So the next slide shows, yeah. Do you want me to chat now? Matthew, do you want me to chat now?
He's on mute. I'm unmuted for a second. I don't mind. I'm just sticking the question up there.
Yeah, it's a good question, and we can get back to it.
Whatever's best for you guys.
Thank you very much. So the next set of slides is very similar to what you've just seen, but we're picking some different examples just to share with you some different ways of looking at things. And this one is just basically the screening and prevention grouping. And on this slide, we're talking, remember, about STD impact compared to the possibility or likelihood of being funded or enacted. And this is, on these two slides, the whole grouping of the items within screening and prevention. So you'll see that the population of stuff in the green zone is pretty well formed, and then there are many that are on the edge of the mean combined cluster ratings, mean combined statement ratings. I mean, in this cluster. And so in this case, we have kind of an action agenda on the stuff in the green zone: prioritize partner services for chlamydia infections, work with provider organizations to incorporate sexual histories, etc., fund, promote, and monitor screening, promote screening for HIV in substance abuse treatment settings, authorize the use of rapid screen testing for syphilis, allow point-of-care testing for syphilis, etc. Then we also have things in the potential for funding and enactment that did not end up in the green zone, did not end up on that side of the STD ratings mean, and they are around specifically number 22, which is have STD clinics able to test for viral loads, etc., and 92, assure availability of medication adherence programs for HIV, and 89 was also high in potential funding to support the development of local health departments' epidemiology and surveillance capacities. Now, looking at the other side of this grouping, looking at the other side of this grouping, we are able to look at the areas of the left side of the grouping, including the ozone, which includes to promote routine neonatal circumcision, which was not considered fundable or having much impact. I'm going to spend another minute or two, if your eyes are not already glazing over, on comparing statements in a cluster on the rating value, in this case, and we're just showing you an example of STD impact comparing researchers to directors. And so this is just an example of how we can show the differences or congruences of opinion from one interested party group to another. So on slide 37, you're looking at, again, the screening and prevention grouping or cluster, and where the interest lies for those, the common interest lies for directors and researchers. So the stuff in the green area, which is pretty populated for this grouping, shows us then the elements that exist that both directors and researchers thought were more potentially impactful for STD than other things in this grouping. And so that is a two-slide set that you might be interested in looking at as well. And then the next grouping, again, is very similar, looking at researchers to directors, but now looking at the HIV impact question. So when we look at, again, we're looking at one of the groupings or clusters that may have some real interest to both groups. And when we look at that group, we see that there is some population of ideas specifically to education in the green zone, focus more on educating people with HIV about actively transmitting, fund research and implementation on structural interventions, and distribute condoms. Then you can also see in the ozone on the following slide that the gray area is pretty well populated as well. And that means that from the point of view of directors and researchers, these are things that are less likely to have an impact on STD. So that's kind of interesting information for us to have. And you have had a lot of information so far thrown at you in the course of this 40 minutes. So I'm happy to turn it over to Dan, who will, I think, lead some questions for you about how we might think about these things and how he might want to get your perspectives on what you're hearing and some things that might lead to some actual progress.
Okay, thanks, Rick. And before we get to what next steps we're going to do, as Mary said, we've reviewed a ton of data with you. We don't expect that you're going to absorb it all at once. And so I just want to point out two things. One is we're going to post all of this on the web on the NCSD page. And two, I just want to go over some of the highlights of all the go zones that you just saw. The first I want to point out is what were some of the win-wins that people who participated in this perceived both had a high impact on HIV, then next we'll get to STDs, and a high likelihood of getting funded and enacted. And the first two are really about screening. And there's certainly been a lot of activity in this area already. And the first is to mandate that all insurers, including Medicaid and Medicare, cover all STD and HIV screening and testing per the CDC recommendations. And after that, I put this, that this one was in the health systems cluster. And these, again, are the top right quadrant or the green area. So these are the go of the go zones. The next is to build standards for routine STI screening, including HIV, in the funds for community health centers and FQHCs. The third, and on the right, you can see the impact numbers of each of these items. The third is to fund intake STD testing, including HIV at correctional facilities. The fourth is to fund syringe access and harm reduction programming and injection drug use-related HIV transmission, particularly in smaller IDU populations. And the last one here is to improve community supports for young gay and bi men and transgendered youth so they can build healthy identities and the self-esteem necessary to avoid contracting HIV and STIs. The next group is also the top right in the green, and these are items that were perceived to have a high impact on STDs. And again, the first two are the same as in HIV, and then the third is to allow point-of-care testing for a broad range of STDs to be used in the field by DIS and staff at community-based organizations. The next is to provide risk reduction counseling for HIV-infected persons who get an STD. And the last is to promote screening for HIV and STDs in substance abuse treatment settings. So those are the top 5 HIV and STD win-wins from the different clusters. The next are items that are in the top left or the orange area of the 2x2 go zone charts. And these are items that were perceived to have a high impact on STDs, but a lower likelihood of getting funded or enacted. The first is an issue that's been near and dear to a lot of our hearts and efforts recently, which is how do we incentivize industry to develop new drugs to treat gonorrhea. The next was to require that all alcohol and tobacco taxes, tobacco master settlement funds, and other monies to be used on, that are focused on public health efforts with a defined split between treatment, i.e. Medicaid, and prevention and public health. The third was to provide people leaving prison opportunities to obtain training for jobs that pay well and have good benefits. And the last is to include health education, including sexual health, as a requirement in the educational system from kindergarten through college, incorporating it into graduation and college entrance requirements. So in other words, these were ideas that were perceived to have a high impact on STDs, but people didn't perceive that they would have a very good chance of getting funded or enacted. Next are items that were perceived to have, did I skip a slide here? I'm sorry. Nope, we're Yeah, I'm sorry. We skipped over the HIV impact, which were perceived to have a high impact in HIV, but a low likelihood of getting funded or enacted. And these included distributing condoms in correctional facilities, the tax provision, and to increase federal funding for HIV prevention and surveillance by $878 million. So the next were in the bottom right, the yellow zone, and these were items that for both diseases, people believed these would have a high impact, high likelihood of getting funded or enacted, but a lower impact for both diseases in terms of reducing transmission. The first is to end Don't Ask, Don't Tell. And the second was to provide resources for linking people to a medical home where comprehensive medical care can be coordinated through a primary care provider. And finally, the gray zone on the bottom left, which were perceived to have both a low impact and a low likelihood of getting funded or enacted, items included to conduct research and implement best practices to reduce racial segregation in housing. And the second was to prohibit any agency receiving federal highway funds which supported public transportation, which are located in many major cities, from obtaining a new contract if that city allows tobacco or alcohol advertising on public transportation. Some of the main differences between researchers and directors and where they weren't in as much alignment about how much impact each of these strategies would have, researchers scored above the cluster mean for STD and HIV impact, but directors below the item to evaluate programs designed to help African American children and youth, especially males, to succeed in school and expand those found to be successful. And directors scored above the cluster mean for HIV impact, but researchers below to expand school-based health centers and funding for comprehensive sexual and reproductive health services, including contraception and screening. So that brings us to the end of the slides. And what we'd like to do first, I think, is just take some clarifying questions. And I know Matthew had one, and there may be some others. And then we can have a discussion about what do people make of all this, what are your reactions, and where do we go from here. So again, a reminder, if you want to mute, you're on mute, so to mute, *6, and unmute, *7. And Mary, do you want to take Matthew's question first, which was that those positive correlations include some optimism with R equals 0.3 to 0.7 so far in your presentation. So higher impact items were also perceived to be more feasible. And Matthew's question is that good news or is that a bias indicator?
That's a great question. And my guess is that there may be some bias included because of what you're suggesting, and that is high impact. Although we really worked on the ratings themselves to avoid the concept of asking the question of feasibility because it is so hard to define. So that when we talked about potential impact on HIV or STD, we used that term as an outcome rather than a process rating for people to focus on. The possibility of funding or enacting was to be thought of as a feasibility rating in a way, but much more concrete. And so that allowed us to ask people to be quite concrete in their thinking around the ratings. But when we look at the ratings on a cluster-to-cluster level, on the pattern matches, Matthew, there seems to indicate a high degree of correlation. But when we look at the statements within each grouping or go zone, you'll notice that virtually all of them have a useful representation of regression from the mean that you would expect if it were really just a bias correlation. So that there are things in the orange zone and the yellow zone in, I think, every cluster except one perhaps. And so that is useful for you to think about as well when we then roll it up and average. Does that make sense?
Yes, it does.
Great, thank you.
Sorry, next we had a question from Kyle Bernstein and then Hunter.
Hi, this was great, thank you. I don't know if you looked at the data yet, but I'm curious about were there differences between the researchers and directors compared to the advocates?
Dan, do you have that handy in your?
In terms of impact, actually, we didn't. I'm sorry, we didn't ask advocates to rate impact. We asked advocates to rate political feasibility, if you will. So how likely they were, each item was to get funding and enacted, and those are all in the 2x2s.
So what Dan is saying then is that when you're looking, I guess I wasn't clear in my description of who was rating what, and I apologize for that. But the advocates were the ones who were asked to rate the potential for funding and enactment so that we could compare it to the potential impact and use the sort of the practical aspect of whether it was funding or not to almost as a feasibility measure for the advocates.
Great, thank you.
Okay. We have a couple questions from Hunter.
Okay, two methodology questions, and later I have some content questions, but I'll let those go for now. First, for the concept folks, I assume that this basic methodology is not something that you've invented and used for the first time for this effort, that we're not inventing the wheel, that you've taken this general clustering approach and rating. Is that true? And can you tell us a little bit about what other sort of work you've done in this and what the outcomes ultimately were by funding agencies or advocates or whatever?
You are oh so right that this is not the first time we've done this. Concept Systems has been in business for 16 years, and we work primarily with federal, state, regional governments, foundations, and advocacy groups, community-based organizations, and educational institutions. And we've developed, I don't know, several hundred specific concept maps, many of which have to do with public health in one way or another. And Dan and I actually met when we conducted an HIV structural interventions initiative for CDC, a few years ago, and 2005, Brenda tells me. And we have, I'd be happy to send you some further information about the methodology if it would be useful, but I'm aware of time. We have a bibliography specifically around public health issues, and I will make sure that we send you the website connection
that's all I really wanted to be assured
so
that I assumed was the case, given your style and obvious expertise in presenting, that this is an established methodology with a track record. That was all I was wanted to be reassured. I mean, I anticipated it, but you've confirmed what I assumed. Second question is that this is all, in its basic approach, it's systematizing and quantitatively analyzing a Delphic approach, and so it's ultimately dependent on who you get it, largely on who you got opinions from. And I wonder, in that context, I have two questions, really, maybe Dan could answer. One is, how satisfied are you that you invited the right 300 plus, and that among those 100 and some who responded adequately represent the views that you would hope to incorporate in this? And second, for Concept Systems, who were the few people who were the sorters, who decided that this proposal is related to and similar to that proposal? That's not a challenge, it's just a question about whether that's a methodological issue that could have an impact.
Okay, those are great questions, Hunter. Let me take the first one, which is, how satisfied am I that we first invited the right people and that we got the right respondents? We went through a very extensive process, sort of a snowball sample, if you will, particularly when it came to researchers and advocates. The STD and HIV directors were a fixed universe of whom we could invite. And we deliberately aimed very, very high for researchers and advocates. And particularly when it came to researchers, we were interested in people whose expertise was in population-level impact, but we also wanted to get people who had a track record in both running formal interventions as well as modelers, a number of different disciplines. And we asked, essentially a snowball method, and I can go into more detail at some point about who those were. Am I satisfied? I'm never satisfied in anything I do that we always get all the right people at the right time to participate. And while the response rate isn't as high as we would like, I'd say in researchers we batted terrifically. STD directors, we batted very, very well. Advocates and HIV directors, I think we could have improved, but we could have improved on all of them, obviously. But I'd say we got a number of extremely high-level thinkers in all of those 4 groups. I'm splitting here the directors between HIV and STD to participate. And I can say, talking about hard-to-reach populations and getting people to answer, I want to thank both staff here as well as Suzanne and Lynn in really helping get the response rate as high as we did.
Okay, thanks.
This is Mary. I just want to chime in on that. We're conducting a retrospective construction here at Concept Systems around benchmarks for projects, et cetera, that are modeled around the kind of work that we've done here. And when we think about the ratings in particular, which is where we collect the demographics and the opinions, we have 189 of the 332 or so who were invited to rate actually did so, which is quite good. Because as Dan said, we really beat the bushes, and people were very interested in contributing, particularly to the ratings. And I believe that Dan took the opportunity to focus the sorting exercise to those who were fairly close into the project, and that is not uncommon at all, because it's an activity that really requires attention, and but we really push on the ratings in order to have the conversations needed about relationship of ideas from one group to another.
Right. We pushed everybody to do everything, and then just sort of a friendly amendment, and then really ramped up the efforts to get people to respond when it came to doing the ratings versus the sorting, because we knew that it was a time-consuming process and there were a lot of items. I want to take the next, we've just got a little over 15 minutes, to just get people's reactions to, I realize for a lot of you this is the very first time, for basically all of you, it's the first time you've seen these results, and I'd be interested in what do you think about them and what does it say about how we think as a field, both in terms of how we judge impact and how well primarily that we prioritize our agendas in terms of policy prioritization. And again, if you need to unmute, it's *7. If you want to type in anonymously or via writing, just type it in. So any comments or observations?
Well, I'll give you one since nobody else is jumping in yet, Dan. This is Hunter again. As you undoubtedly are very well aware, there are places where things get boxed in brown, green, gray, yellow, even though they're very close to the line. And it gets to the broader point. If you look at slides 25 through 27, where you have the vertical lines showing the mean Likert scores, and then the lines connecting the impact versus impact versus feasibility, I guess it is basically. The numerical range of some of those is actually fairly tight. You show a Likert scale range, for example, in slide 25 between 3.9 and 3.5 on the left, and 3.9 and 3.5 rounded up on both left and right, so that even a fairly steep slope showing an apparent disconnect is actually quantitatively not a very great difference. And so it just makes me think that just be careful about automatically going forward with a strong proposal just because something happens to fall on one side of the line. You may have statistical significance with little operational meaning in terms of feasibility, for example.
Dan, would you like me to?
Why don't you jump in with the first comment and then I'll make a second.
You're absolutely right, and that's one of the reasons why we caution typically when we look at the pattern matches to look at the scale to say what does this tell us that is interpretable and useful rather than statistically defensible? And so in the pattern matches themselves, we often do significance testing to relate the higher end categories of items to the lower end. We often find that there's significance between those two, but typically not significance between the middle ones in either of those ranges. So that's how we use the pattern matches to get people in the ballpark of thinking about whether this rings true, whether it's confirmatory or relatively new information for them. But then if we look at the go zones, you'll notice, and I'm just flipping to 41 and 42 right now, these are researchers compared to directors. It doesn't really matter on impact. And you'll see that the scale, pardon me, as one would expect, is significantly expanded from that which you see in the pattern match. The pattern match is an average of averages, and in this case, we have a scale of which is on directors is basically 2.71 to 4.46, which is a much greater representation of the average, typical respondent's use of a Likert-like scale that is 1 to 5 limited. So it's very common for people to use the scales that then self-limit the numbers that are involved. And having said that, the approach and the representations of the data allows people to make some determinations as to the relativeness of these scales to each other. And in a case like this where we're looking at, say, statement number 84, which is extremely close to the crosshairs of the mean of that cluster, that would be a conversation that people would then say, well, as you're suggesting, I think, Hunter, does this make sense for us to rule this out, or what? So what, I guess is the question. Do we want to act on this with this information that helps us rather than rule something out? Dan, you wanted to?
No, I think that answers it pretty well, and we could talk more about this. I also want to make sure we get anybody else. Actually, Hunter, does that answer?
Yes, it does. I'll shut up as well.
No, I like those questions.
Right, no, they're great.
Kyle, is just a follow-up to Hunter's comment.
Yep.
Sorry, someone came in. As a follow-up to Hunter's comment, would it make more sense to just pick items that had an average of greater than 4 or something? Because I also am concerned that there are things that fall below the mean that we're going to discount based on sort of a mathematical anomaly, and there's not really any practical reason other than it falls below the mean.
Yes, and again, this is Mary, but I'm sure Dan has some useful comments on this as well. As I think I was probably not very well describing just now, the information that you have here is assistive, interpretable and assistive in nature rather than diagnostic and dogmatic in nature. And so, for example, if you're looking at the go zones, you'll notice that the crosshairs are dotted lines. They are not hard and fast. And my view is that they are really useful guidance so that conversations can take place. And I think that Dan has some very specific ideas about how to talk about what we might what might we do to change our thinking about these things. Is this useful information that describes a perception that others might have that we want to take into account, but certainly not rule out anything?
Yeah, I think to follow up on that, I think the phrase about being diagnostic is helpful. What we're essentially doing is facilitating a discussion where we're holding this mirror back up to the field of researchers, of advocates, and of directors. And nothing in here is engraved in stone. And I think particularly what I found really intriguing is there are several items which rated very high on impact, but for one reason or another rated low on political feasibility. And if you look at those, you could say, well, those are items which may make sense to try and alter in some way in the way they're described that might make them much more politically feasible. I think if there are items that are politically feasible, have a good chance of getting have a good chance of getting funded, or enacted if they don't require funding, but they don't have any impact. We may not want to have a lot of discussion about them. But I think particularly if you go through the orange zones, where again they have a high impact but less political feasibility, there may be some ways to think about them that may break them, may make them more, may give them sort of more of a prioritization for us. I'm trying to think of what's a good example. Well, there's some that are about curricula that provide comprehensive sex ed, including gay positive images, and there's some about health education requirements. And we can't begin to interpret why some of the items were rated low in terms of feasibility, but they may be worth discussing and having some work groups or smaller groups of people to discuss about, well, if these are indeed something that we think is important in terms of reducing transmission, how could we either reframe them or move them ahead in some other way so they're also, they have a chance politically.
Hello?
Hello?
Hi, this is Barbara Conrad. I just wanted to pick up on something that Hunter was saying, and to say that as a participant taking the survey months ago, I remember feeling several times in the process of the survey that I wasn't able to make enough distinction, as if only two elements, only two segments or two numbers on a scale were available for something that I thought could have more numbers on a scale. I'm not a researcher, so I can't speak to 5-point scales or 10-point scales or anything like that. But it's just, I remember feeling several times as if I couldn't make the distinctions that I thought would have been more meaningful. And I think maybe that's also what's showing up, with things clustered toward the center, is that maybe other people also, weren't able to make the distinctions that they wanted to.
Right. No, I think that's an important point, Barbara, and you're certainly not the only person who felt that way. A number of your colleagues did. And not to defend the decision, but to explain it a little bit, is we wanted to make sure that we gave people the opportunity to say this could have an unintended consequence. So we wanted to give them a negative rating option. So that's why we had two items that say this could actually facilitate transmission rather than reduce it. But I certainly see the downside as well. Mary, I don't know if there's anything else you want to pick up on that?
Yeah, it's unusual for us to have a plus-minus scale in the same scale. And so this was something, as Dan's suggesting, to try to capture the field's view of some potential impact. As it turns out, I don't believe, Dan, that that's the way people use the ratings. I believe that they use them on a more or less impactful scale just by virtue of the way the ideas fell out. So, for example, if you look at the stuff on slide 41 around the ozone stuff, number 40 is not going to have a negative impact, but it's going to have a much less positive impact than other things. So I think, right. Although we did think that we would try the scale that had negative, neutral, positive within one scale, I think that what happened is that many people began to use the scale as a much less impact, much more impact scale as they went forward.
I want to take Hunter's last question and then move us into some next steps because we're almost out of time. And Hunter makes an interesting observation, which is another issue with feasibility enactment potential is that these change over time. What's not feasible now may become so in the relatively near future, and feasibility of these could be very different in a second. I think you would probably finish that sentence somehow, but the historic
second Obama administration.
Right. Well, let me just say we came up with this idea during the Bush administration. We carried it out in the very first months of the Obama administration, and then ended up that actually went into I guess the second year of it. So you're absolutely right that what's politically feasible yesterday may not be today, and today may not be tomorrow. Actually, any last questions before I move us into some of the next steps?
I typed one in, but it's a low priority, so just go
okay.
on.
We can talk about it with you another time,
yeah.
But thanks for writing it. I'd be interested in hearing from people. Let me just list out all the 3 questions I've got, and then we can take them one at a time. There were some items which people felt were really in the green zone. They were important, but when I look at them and I imagine, well, could these be turned into legislation as written? It's very, very difficult. There's one about building supports for young gay men and transgenders to make sure they have social support. And I'm wondering if there are people who would be interested, either on this call or that people can think of, that would be interested in taking that idea and thinking, well, what would the specific policy initiatives be to really advance that? Actually, why don't we just, I'm famous for asking 3 questions at once, and I don't want to do that. So any thoughts about an item like that and what we could do to turn that into something operationalizable?
This is Ralph Wilmoth, and I would make this observation about anything that's going to be pursued, that those persons who spend most of their working life doing legislative advocacy would be better equipped to frame this up in a policy statement, or any of these that would be pursued, than those of us that do this as part of our work, but it's not the primary focus of our work.
I'm sorry, could you say that one more time, Ralph?
Yes, people like Suzanne who do policy work all day, every day, are far better skilled and experienced in trying to frame these ideas up in a policy format.
Right, right.
Is that easier to understand?
Yeah. Yeah, no, and I think it's absolutely true. And one of the things we wanted to do with this whole project was start to build more. There's obviously a number of solid bridges already between researchers and advocates and directors, but we wanted to really expand that conversation and bring all of those 3 parties together.
And there's one small point to that, and I think Ralph is right. This is Matthew, by the way. The Division of Adolescent and School Health, I believe, tracks gay-straight alliance clubs in schools. So you might actually have a useful indicator variable for something on the lines of a more positive, less homophobic portrayal of gays and lesbians, adolescents in an important setting.
Right. And I think this is an example of the kind of conversation that we would hope to see going forward. The other is just to touch on the difference between researchers and directors. One of the things we wanted to get a handle on is how do those 2 groups see things differently? And if they do see things differently, we found a couple areas where that was true. It either means one of 2 things. Either the directors don't know the literature or the studies haven't actually been done. So what we're hoping is that as we go forward, that those 2 groups can work together and say, all right, here's some items which either they just haven't been sufficiently distributed, or that these can help inform a research agenda. So last question is, actually let me just leap 2. One, we're going to draft a short narrative final report. We're going to post this on the web, and I'd really invite people to be in touch with me and with NCSD about any observations or comments or ideas of how to distribute. And Hunter suggested that, or he actually asked, what are the plans for publication and presentation, and it would be good to do this at ISSTDR. This has been accepted as an oral at ISSTDR, and as soon as we find the funding to get there, we'll be presenting it. And so it was nice that you thought so and the committee thought so.
Give me a call.
Will do. Thanks. So with that, we're just about out of time. I do really want to thank all of you for participating both in the brainstorm as well as, and the ratings and the whole process, as well as taking the time today to look at the results. Again, I want to thank Concept Systems for just shepherding us through this process. A big shout out to Lynn Barclay and Suzanne Miller for being part of the work group to really think through this and keep us all on task. To Bill Smith at NCSD and Jeannie and Lynn for helping provide the funding. And with that, I'm going to end. Are there any last comments or last questions either from any of my co-presenters or from anybody on the line.
Dan, this is Bill from NCSC, and in turn, I just really want to thank you for all of your leadership on this over the years and pulling this together and actually seeing it through to this point. So you have just done an extraordinary amount of work to make this happen, so you have our profound thanks.
Thank you. And I think it's fair to say thanks to Gil Boland for allowing me to take some of the time to do this. So thank you, Bill. It's very nice. Any other questions or comments?
This is just a thanks from Concept Systems for continuing to think creatively, all of you, about these critical path issues for us as a society. So thank you.
All right. So with that, again, my invitation to all of you to send in comments and questions. I've already got several on the screen. And again, thanks very, very much for all of your time and help throughout this process.
Good work, folks. Thank you.
Thank you. Bye now.
Thank you. Please stand by.